I see patients of all ages for almost any complaint. I'm oftentimes the first person that someone will see as far as an evaluation goes. If you're coming in with knee pain, hip pain, shoulder pain, a sprained ankle, things like that. I specialize in non-surgical or conservative treatment of those orthopedic injuries. I'm usually attempting a targeted intervention or targeting an intervention towards the patient's pain or the patient's complaint. I am an athlete myself. I was a competitive swimmer all through high school and college. I do triathlons now. And I've always stayed active, and I find this connection with my patient population of a group of people that wants to stay active. It doesn't matter if staying active is running a marathon or walking around the block. Someone's coming to see me because something has happened and they can't be as active as they want to be. So it's my job to help them get back there, whether that's physical therapy or an injection or a brace, or getting more information through further imaging. Our goal is to get that person back to the activity that they want to be doing. And I think some of the most satisfying patient visits or patient conversations that I have are, you don't need to see me in follow-up, but I'm here if you need me. And usually I get a big smile out of the patient at that point.